Mental health, breaking the taboos. In a world that is still stunned by the pandemic, mental health is thankfully getting the right focus, especially among corporates and large organizations. This panel is going to understand and embrace all aspects of mental health and the ways to normalize it. On this amazingly put together panel, I have Aris Rizvi, Head of Health Promotion, Anviti Insurance Brokers, Mukti K. Bosco, Social Entrepreneur and a founder and Secretary General of Healing Fields Foundation, Shubha Pandian, founder and director, AGUA Women's Leadership, and we have Daniel Eckhart, Swiss Re Institute Advocate, Swiss Re. So welcome, panel. I'm going to be moderating this segment and this session, so it's a joy, pleasure, and honor. I'm going to start off with Aris. Aris, a couple of opening thoughts on the panel itself, the topic, and then I'll come to you, Mukti, Shubha, and then Daniel. So Aris, if we can hear from you, your opening thoughts.
And I shall unmute myself. Yeah, it's always a pleasure talking to you, and we've had lots of conversations around mental well-being and its importance of, especially in the context of what's going on right now. And it's a great honor and pleasure to be here. I hope to share some of my experiences, some of my insights, but most importantly, I think I also want to imbibe some of the experiences and thoughts that the other panelists have on this subject as well, and let's see where we go from there.
Right. So, Mukti, can we hear from you on your thoughts on and opening call?
Yeah, the pandemic has brought it to the open the need of mental health, the importance of mental health, and the need of mental health support, not only at the urban levels, not only at the corporate and educated levels, but all across the spectrum. I think this pandemic has opened up a lot of distress at various levels, a lot of loneliness at various levels, a lot of insecurities, fear, anxiety, and it has also exasperated mental illness. So we would need to separate these two and look at it as to use this pandemic as an opportunity to bring about the talk of mental health, to make it mainstreamed and be able to reach out and move away from the stigma of any kind of support and acknowledging that we are facing a problem. So that, from that perspective, I think this pandemic has really given all of us a lot of opportunities, a lot of introspection as to how we look at the world and ourselves.
Absolutely. I think it's important for us to sort of set context to the conversation going forward. So tell us a little bit about what you think and your perspectives are. Just unmute yourself.
Apologies. All right. It's a pleasure being here and participating in this particular panel. And I can't agree more to what Mukti said. This pandemic has actually brought surface this very important topic. There are a lot of people who were reluctant. I closely work with corporate and I work in the women leadership area. And whenever we take this particular topic to some of the companies, people were reluctant to talk about this. And this pandemic, I think I've done close to 50, 60 of these sessions, and everybody is looking forward now to mental health as one of their biggest priorities, and people are talking about it. Talking about this particular topic itself, takes us one step closer to the solution. So I'm glad to be here.
Thank you so much, Shubha. Thank you. Daniel, I'm going to bring you in here and I'm going to ask for your perspectives because you're sitting in another part of the world, but tell us how it is and in context of mental health, if you can speak to us a little bit about your perspectives.
Sure. First of all, great to see you, Shreya. It's been a long while and wonderful to be here with all of you. You guys have said it already, and you've mentioned it. I'm in a different part of the world, but it doesn't matter. It affects all of us wherever we are around the world, and that makes it a very particular, a unique situation, if you will. Over the course of this talk, I'll mention a little bit of how what we're doing at Swiss Re at a corporate, how we have actually been fortunate in addressing the topic before a crisis came about. But as an opening, like since the topic is called like breaking the taboo, I really just wanted to say that I guess one statement, like I was asked once, like in like the 20 years that I was involved in D&I topic, what was the biggest success? And I thought about it for a moment, and what I came back to was really something very small, and it is openness as such. 10 years ago, like we created an internal, entirely open network at Swiss Re, where back then already everybody, like from the top to the bottom, started sharing in very, very personal ways exactly who they are, how they feel, whether it's good or bad. And that brought the company together a great deal. And that's one of the reasons why openness, that the thing that helps to break down the taboo, is on a very good path at Swiss Re already. Back to you.
Right. And I remember this. I remember talking about the openness culture and the sharing culture way back, I think 4 years ago that was. So Aries, I'm going to bring you now. Hi. I think we have another line that has sort of come in. I'm sorry, but I can hear another voice. Okay. So Aries, I'm going to bring you back in and I'm going to ask you, and I'm going to ask all of you actually, why is it still such a struggle when it comes to getting conversations around mental health going? Why the taboo? We're seeing such absurd examples of mental health is perceived to be, especially in the mainline news nowadays. So Aries, if I can get some thoughts from you, and then I will, switch over again.
So first of all, I think I think the most important thing is that we must realize that the narrative of mental wellness and mental health stems a lot from the socio-cultural construct of a society, and fortunately or unfortunately, as Indians, we know that mental health and mental illnesses are something that are frowned upon. We use cuss words that basically allude to someone's mental status, health status as well. So that's one. Number two, I don't think the popular media has been doing a lot of justice towards the cause of raising awareness around the importance of mental health and wellness. We've seen recently what's been going on, dominating our national news headlines, where we've let go of such a wonderful opportunity to bring the cause of mental health at the forefront. And for some reason, that whole conversation got hijacked by other causes, other interests, and we've let go an excellent opportunity. Of course, I mean it's tragic that someone died, but instances and institutional moments like these are really the ones where you could start having conversation around mental health and mental well-being. And then it's a complicated one. Both you and I know that there are issues around passive masculinity, toxic masculinity, what society sees of being a strong person. You mentioned being educated person, right? As if both are interrelated. So this is a tough one to handle. But I guess the more conversations we have, the more we normalize this subject, and hopefully things will start improving in future.
Mukti, I know you speak very passionately about this because obviously you're seeing a lot of connected issues that are also arising because of the scenario that is in. So I'm going to bring you in here and I'm going to ask you, why such a taboo, and what are your feelings and impressions as you interact with people that you're getting to know in your conversations?
One of the things is like Arif was talking about, there is a lot of stigma, there is a lot of, it comes from age-old times that, we are not able to differentiate between mental health, mental illness, or mental retardation. So everybody is painted with the same picture, and the kind of slur and abuses that is hurled, and it has always been derogatory. And India being the community that we are, we think that family is everything, plus also the community that we live in is supposed to be giving you the support that you require. So the understanding that a person would possibly need their space and will need to go out and get the help. Like, for example, we work with community health workers in rural India and rural and tribal India. And we train women as community health workers, and one per village. So each batch that we train, we have 50 women that we bring them together. And without even we, on a focused manner, looking at the mental health issues or the camaraderie and the sisterhood that had developed, when TISS, Tata Institute of Social Sciences, did a third-party evaluation on us, one of the most important things that came up was the sisterhood that was developed among these 50 women who had never met each other before. And they said that they could actually talk about some of the issues that they could never ever talk about within their families. And spouses and in-laws, though, in a rural setting with semi-literate women, they're not going to be, the spouse is never a friend, in-laws are never their friends. And so they needed this support system. So one of the nicer things was this support system got developed among the women. And now what we are seeing is this has got deep-rooted because of the pandemic. And the other major issue that in the morning also we were talking about is a patriarchal society that we live in. Even in this case, that the whole the national media has taken over, the very sad case of a suicide, and the way that the women have been abused by women themselves. So here I'm not even talking about patriarchy in terms of just the male gender being patriarchal, but also in India, unfortunately, women are also equally patriarchal. And it is always the women's fault. And that becomes an added responsibility and burden on the women themselves. And even during this pandemic, that is what we are seeing. The men work from home, women work from home. But the burden the women are carrying is much more higher. So, we cannot talk about mental health in isolation. We need to look at the context. We need to look at the setting that India is in. And now is a great time. There are a lot of mental health helplines have come up. So pandemic has been, it's like a Pandora box that has been opened up in various ways, and mental health has happened to be one. And we need to be able to face it and do something about it. Can't hear you. You're on mute.
I was just saying, yes, I think that's very important in context setting of where we are. So at this juncture, I'm going to bring Shubha in and ask her, because I know she's been working with women and women in leadership. So interesting points of view in context of gender and mental health. Mukti, you bring that from the context of working in the grassroots levels with rural scenarios. And Shubha, you bring that in from the whole context of leadership organizations and women. So you tell us your interactions and what that has led to in terms of what you have found in context of why it's still
So, way back in March when the pandemic began for India, when we wanted to talk about this, and some of the organization reached out to us saying that, how do we help women? By then, the media has just printed all over, women are suffering, women are going through tough times, and women are the most affected ones. But we didn't have any context or data from India perspective to actually look at it. So we went about doing our own survey. We reached out to 800 plus women leaders, mostly in India, and a little bit of representation from outside as well. So we reached out to 800 plus women, asking them simple question as to what is this pandemic happening? What's happening to them? What is their biggest challenges? How are they facing it? What's been their game plan and things like that? As predicted, 55% of the women came back and then said us big stories about what's been happening and how difficult it is to manage the work and the home, inside the home, because for women, it's always been a kind of a place that while they are nurturers and they become housewives and things like that, they also wanted to go out. Going for work was a completely different scenario for them, because it brought them out of their thinking patterns. It gave them a break. In fact, a lot of women came back and then said, we are missing those breaks. We miss those coffee times with our friends. We miss that, driving to office, listening to a couple of music online, these are things that they're missing, and they're constantly bombarded with work after the other. And they had that decision fatigue, what to cook for their kids, or what to do for their husbands, or how to take care of their presentations, or how to prepare for the project that they are deeply involved in. So this study was really, really helpful for us. One, we got it as a survey. Another one is we also went ahead, and some of the stories we wanted to hear back from the person. So we reached out to them and did an interview, full-fledged, to understand how this has been. And we put together some of the topics. We wanted to keep it very, very, useful. We didn't want to bombard them with the science and things of it. And we are not clinically, experts to go back and give them that these are the solution. But there is a very thin line of difference between talking about mental wellness and mental illness. And we were in the space as coaches into mental wellness, right? And when it gets extreme, then you get into a mental illness, then where you need clinical support. You can't do it without, you can't deal with that, coaches with. So being coaches, we wanted to work on that space, and that's when we created our module, and we've done close to 50-60 sessions with different corporates. And one of the things, Shreya, that we noticed is when we create this platform for people to where we talk about emotional health, and we talk about simple things like it's okay to not feel okay on a given time. It's not necessary that you have to be 100% potentially performing as leaders and sitting in front of your laptop all 24/7, but some of those days you would be dragging yourself out of the bed and you will not be okay. What do you do with that time? So when we talk about that one, that's when everybody opened up, and then everybody started talking about, some cried on our sessions, some came back and then said, how do I deal with my guilt and things like that. So I'm going to take a break here and then, bring about a different perspective. Yeah.
Okay, I think that's the takeaway from this line for sure. It's okay to not be okay. Daniel, I'm going to bring you in here, and I'm going to ask you, in your experience of the way you have built and as an author and the multiple hats that you wear, tell us your experience and your perspectives on why do you think this is still such a taboo? And you said there are no geographical barriers. So tell us a little bit about your thoughts on this.
Sure. So why is it such a big topic? I mean, I guess societally, if you look at the big picture, we've really look at pretty much every job. We separate our lives. We call things work-life balance, work/life. There's this assumption that the moment when we go to work, we're not living. There is a separation there. When you're living, you're not working. I hate the term, by the way, work-life balance. I just have a life, and I try to bring my full self to wherever I am. Sometimes that is at my employer's offices, and sometimes I'm at home with my family. There's an issue right there, because when we go into a workplace, we put on a uniform, we put on a persona. Quite often that may be an actual uniform, it may be a suit, you may be putting on a tie. And with that comes that you leave part of yourself out. So like you're not bringing your full self. Like in terms of the corporate world, what that has meant traditionally is that it was entirely fine to do that. You were considered the expert or the leader, and that was the persona you were then living at that moment in time. But that meant that you kept part of yourself out, and traditionally that was the thing that was considered the weak part. Leadership was associated very clearly with strength, and vulnerability with weakness, which couldn't be more wrong, because we know today that the emotions, the real stories, the pain, the difficulties, the challenges, the hard times, like COVID right now, these are the times that really bring people together. But only if you allow that to exist, only if you allow that to come to the fore. And our leaders, very fortunately, over the last 10 years, they've made gigantic strides towards really being vulnerable. And it's for the individual, that's not easy, but it's a very, very positive journey to embrace. That's the one thing, right? Let me just add like one more thing on the individual level, because the reason why we still have the taboos is simply because people don't know how to respond to them. They like if somebody is off, if like at the workplace, for example, if you see that somebody hasn't been the way they were for the past week, people tend to not address the question. Just the simple asking, "How are you?" Or I've noticed that, you've been different for the past few days. Is everything okay? Is something wrong? And that opens up the possibility of a conversation. We know that individuals in hard times often keep to themselves, not even sharing something with their loved ones for up to a year. And that couldn't be more harmful to the individual. But the same goes for the team, for the leader, for the company. And so fostering that openness and raising this awareness so that people start asking the simple question, "How are you?" Is hugely important. And actually at Swiss Re, we do this at this point by building up mental health champions all around the world. And we send them through mental health first aid trainings so that they have the level of awareness and also the degree of comfort that, like, if they do ask the questions, they know how to respond. I'll stop here.
Yes. I think that's, again, three things that you spoke about that really stood out to me, especially, is the work-life balance thing. And I agree, it's work-life integration because it's not one or the other. The second point, which you spoke about, which was vulnerability and the ability to build spaces of comfort and safety where people can actually open up and speak. So, Ari, my next connect question to you is, you spoke about how workplaces are just a microcosm of your community. So tell us a little bit about what we can do as workplaces. And like Daniel was just saying, to have mental health first aid trained people perhaps, and what else can be done at the end of workplaces to actually make this a lot more easier for people to sort of, come out with their stories or create sharing platforms. So Aries, let me bring you in here and hand this to you.
Sure. I think you asked a great question, and it perfectly ties into what Daniel just mentioned. When you go into work, you put on a uniform. Now, that uniform could be a physical uniform, or it could just be a persona that you put on. I think we need to be cognizant of the fact that perhaps you need to get comfortable with the fact that even if you're at work, as a leader or as a manager, I should be going out and providing that sense of safety and security to my employees by telling them that, hey, you know what, even if you show your vulnerabilities to us or let them known, it's not going to have any impact on your overall career aspirations or your job for that matter. The other thing that I also would want HR leaders, especially, to keep in mind is not to treat mental well-being interventions at workplace as a checklist activity, nor is it an employee engagement activity. It is something which is far more serious, and it needs a lot of considered and evolved thought to get into that. I would rather them not get into it, versus getting into it in a ham-handed manner. These conversations could very easily become binary in nature, right? A lot of times, really, when diversity and inclusion functions, they tend, and they do, tend to take up these causes. They may end up being, sounding board for the fact that women are, extremely stressed out. We need to stop doing that. For example, mental health is not a gender issue. Of course, gender biases, patriarchy, are no doubt an important element of a social construct of what we think of, what contributes to stress, etc. But we need to really address stress from an individual point of view. If currently women are facing, by the fact that they're homemakers plus professionals working, there is equal amount of, stress on the other side of the gender, where sometimes men who are primary breadwinners for their families are under a lot of threat for job losses, right? And that contributes to stress as well. So let's not reduce stress and mental well-being to gender binaries, and also look at it from a individual perspective.
Absolutely. I think you spoke about something again very poignant and relevant, because it's individual, and actually the minorities also go through a very, very interestingly difficult journey in this context. And Mukti, I want to bring you in here because I know you were talking about access to mental health and mental health care, and I think it's important to bring in now the context of how, again, even that becomes binary in so many ways. And you were speaking this morning about access and how a lot of communities don't even have the basic access. So Mukti, I'm handing this over to you, and can we hear your thoughts on this one, please?
Yeah, working in the rural sector, working with the poorest of the poor, and working in inaccessible places, it is just not gender and patriarchy alone, but also the access to basic services that you and me take for granted. You and me take for granted clean water, toilet, sanitary napkin, your internet connectivity, all of this we take it for granted. But for the women that we work with, those are luxuries. And having said that, just to get access to basic health care of immunization, pregnancy, antenatal checkup itself is a huge challenge, and it became compounded during the pandemic and during the lockdown. The number of people who have lost their lives because they could not reach a doctor, and the number of pregnant women who went into a labor and they had to move from hospital to hospital for deliveries of their children, and the babies dying or the mothers dying, is a reality. A reality which many of us do not know, that the India that we live in, that there is another India that exists. The Exodus was the first time it came about as a collective shock to the system that there are so many migrants have been living either within our houses or within the neighborhoods, who they were completely invisible to us. Okay, having said that, even if basic healthcare is not accessible, mental health in terms of counseling for the poor, even in the urban areas, is extremely difficult to get. And in the rural areas, that doesn't happen. If you have a problem, you go talk to an elder person within your family, and you cannot go beyond the family. Your own family that you're married in, or the family, your family that you came from. So you go and discuss that with them, and you get help and support from them. That's what supposedly the Indian culture, quote unquote, is supposed to be doing. But to get any kind of professional counseling or any kind of professional therapy is just not there. We are Healing Fields. We have been part of a coalition, national level coalition. We did, with 44 partners in 13 states, we did a survey with about 17,000 households in 68 districts in India, the poorest districts. And some of the stuff that came up in that, which I'm going to only talk related to the mental health and their health, 35.7 respondents resorted to self-treatment for any health issues. And that means when a paracetamol could cure that illness, they resorted to steroids, because that is what the pharmacy or the kirana store had given them. And 73% of the rural population and the migrants had fear and anxiety. They've all reached home to their rural villages. So 73% had fear and anxiety. 71.4 male respondents and 75.5 female responded. They said that they had fear and anxiety in terms of what is going to happen tomorrow. Not even 1 month down the line, not even 3 months down the line. Tomorrow, how will I put food on the table? Will I be able to go back to the work that I have left behind? Will I get my money from the bank? Will the monsoon settle and there will be, they could sell their agricultural produce? These were some of the major issues. 34.4% said that they were irritated for no reason. And all of us know irritability for no reason is a sign of mental health. It's a sign of problems. 25.6% of them were sleep deprived. They were not able to sleep in the nights, and they were very anxious, and they were not able to, or they would get up early in the morning. 82% of the respondents did not want to talk about these mental health issues with anybody outside. So as part of our education and awareness creation and outreach program, we had circulated some mental health helplines, which they would be able to provide them mental health support in Hindi and in Telugu, because these are the two regions that we were working in. And what we realized is, where were these counselors? Where were these therapists? They were all in urban areas. And they did not understand the Hindi that the migrants were speaking, the Hindi that the rural people were speaking. And they had no clue about their lifestyles, how different this whole thing is. So we have a huge dearth of mental health professionals. Now, if we look at psychiatrists who are supposed to be treating mental illness, we have them in the urban areas, maybe in Tier 1 and Tier 2 cities, Tier 3 cities. We don't have them. Where do they even go? Or if we talk about mental illness, medication for mental illness, where is it available? In a small little town? Definitely not. They would have to go to the capital city. I mean, this access becomes more and more. And what the other thing that we were seeing is there were a lot of depression and there was spurt of suicides. Thanks to the national television, there were spurt of suicides, because people thought that was one way of solving the problem.
Yes.
And that is scary. That is scary. And what, as a community, as people within this country and the state, well, how can we actually reach out? What is it that we can do? And here I know that the government has a huge role to play. The corporates also has a role to play in terms of acknowledging that there's a dearth of professionals, and how can we increase that
gap? Gap, yes. Thank you, Mukti, for that. Shubha, I'm going to come to you in connection to this, but talking about safe spaces, talking about spaces sharing, because you spoke about it. Tell us a little bit about how do we solve for this, because the problems are connected. While they may be geographically different in terms of access, but at least the fact that what is needed is a safe space is relating. So tell us a little bit about that. And this is going to be my last round of questions before I head off into the rapid fire. So after you, I'll go to Daniel, and then we will move into the rapid fire. Just reminding you, we have 10 minutes to go. So let's
Absolutely.
share.
I'll keep it short. So I'm just going to continue from where Aris kind of dropped it, because the mental health problem is not just for women, it's for men as well. While we were addressing some of these sessions based on the survey that we conducted, we also felt that this is not a problem which can be solved in a gender-oriented way. So we created something called Agua Awkward in the social media platform. We called it Awkward because we wanted to bring in all the awkward topics to be discussed there, where we brought men and women together in a platform where they could talk about some of the awkward things that they were not talking about. And one of the points that Daniel kind of rightly pointed out in terms of vulnerability, everybody being in Indian context, we've been always said that, okay, buckle up, do this, you're stronger than you think, and things like that. In Agua Awkward, what we started doing is, as we pioneered by going back and then saying, okay, we are suffering, we are not okay, we are going through this particular phase of life, and we need to do this together, and making our stories heard. We made ourselves vulnerable and put in there our stories, whereby people came out and started discussing about, yeah, this is the same problem with me as well, and that kind of brought in a kind of, whatever you call it, cis brotherhood or whatever it is, and everybody were talking about the thing. What beautifully formulated there was, people started feeling that we are not alone. It's not just me, feeling this particular thing early in the morning, I'm not able to get out of the bed. It's not just me, it's everybody, right? It's everybody around me is facing. So I am normal. It gives them a sense of affirmation that I am not alone. It also gives them an opportunity to reach out to another person and talk about it. Okay, are you feeling that way? So once you, Shreya, comes and say that this is the problem that I'm facing, it's easy. And we're not talking about just the people who are having a very straightforward, life. We're talking about single parents. We are talking about single women or single men who are alone, living in that between their four walls, and they don't even have another sibling or a parent or a relative to talk about, because they've been traveling from one city to another, working alone. So we've been creating that safe space and bringing in this dialogue. And I guess the dialogue between the people and talking about and making this normal would bring about a huge amount of change in how we deal with mental health. I'm taking a quick pause. I'm just looking at your face and I'm just quickly stopping.
No, I'm just thinking. No, I was actually thinking about normalizing the conversation, because that's I think that was my connected question to this. So Daniel, I'm going to pass the baton on to you and ask you, where does the buck stop? How do we do this, and how can we contribute better, both as individuals and organizations? So I'm going to bring you in here and quickly get your thoughts on this one.
Okay, the two sides, the organizations, leadership has a clear responsibility, and leading the old way, the traditional way, just doesn't suffice. Like anybody who's still trying to lead that way should be kicked out. It's not a fit leader for these times. We have two halves of the brain. We have a right side and we have a left side, and you need to truly bring your full self to work as a leader. You need to lead by example, and that means you have to show your human side. You have to tell your stories. The telling of stories is essential in companies, because it puts images in our head. It reminds us in very personal ways constantly of what's really important and what matters and why it matters. If you have a leader who just tells somebody to walk from A to B, that doesn't touch anybody, that doesn't move anybody, and we need people to be emotionally engaged. So emotional leadership is key. That means vulnerability. The best of our leaders have absolutely realized that this is also where you create the actual strength, the connectivity between the network just becomes so powerful. Shubha mentioned it, like with the sisterhood platforms, like, right? So but you cannot just tell people things. You need to live things. Luckily, we have those leaders, and we've started our mental health network in 2017 already. We're going, we're global. So we have mental health champions, colleagues, employees just like me around the world who are committed to asking the question, to raising awareness, to asking somebody who may not be themselves how they are. We have very clear ways of how we go about things. So there's the employee way, the network way. There are official ways too. So like the company provides employee assistance programs that are entirely anonymous, that are outside of the workplace. Health champions, we signpost. We help people like where to go. But on an individual level, just to also keep it short, it's just me. And it's just you, and it's the people around us, like whether it is a partner or a child, the extended family, your team at work. Just remember that like we're all human beings, and look past the persona. Like see the human being that's there and ask the question. Yes, awkward is exactly the right way of putting it. It will be awkward,
yes,
all the time at the beginning, but that's an awkward we need to embrace, and it is like we need to also like get comfortable with being uncomfortable, because that's where the real conversations begin to happen, and that's where the moment when you get somebody to open up, to actually vocalize what they're going through, that's the moment when healing can begin. That's the moment where you quite often can actually like help somebody before they get to a chronic stage.
Wow. I know we're almost at the fag end of the panel, but I think this conversation has brought so many aspects to the fore. We're quickly going to ask our audience, if you have any questions, do type it in to the Q&A box at the bottom right of your screen. Daniel, I'm going to go backwards to the rapid fire. I'm going to ask you just 3 words or the 3 quick phrases that you can think of, the 3 primary challenges you see, why this is still a taboo.
3 primary challenge. Well, it is the awkwardness. I mean, like society is not where it needs to be, but we're on a very good path there, because you can now see it in leadership, you can see it in companies, you can see it in conversations such as we had. Like a few years ago, the Dive-In Festival would not have had mental health as a key topic. Well, it's all connected. It's really there. I mean, like the systems we have are by and large in place. Like I think maybe like one major more thing that I'd like to mention is we still tend to look at mental health and physical health as 2 things, and they are connected, of course. Like if you are physically unhealthy, it will have a mental health impact, and the other way around over time. So if we just look at the world and ourselves more holistically and really become aware of that, not just sort of like in passing, but on a moment-to-moment basis, we'll be on a better path. I don't know if that was 3 things, but...
Yes, it was. Thank you, Daniel. Shubha, I'm going to ask you the 3 things that we can do to create safe spaces for conversation.
I think I'm going to talk about awareness. I think as much as awareness is spread across with regard to mental health is very, very important, because it's like you have a knee pain, you know what to take in. If you have a headache, and in India, we are still talking about self-prescriptions and things like that. We are still so used to it. So that is one thing, creating awareness on mental health wherever possible in every platform. That's very important. Stopping stereotyping. Stereotyping is a big thing, to do with anything. If a woman is very quiet, introverted, comfortable in her space, she's again, stereotype saying that, oh, that woman is mad. Or if in case she raises her voice, again, that is, bucketed under, a mental health problem. Stop stereotyping. That's one thing. The third one is like check on your loved ones. As much as we are talking about healthcare and all the systems, corporate things, I do this. I reach out to 10 people every day morning, just saying, hi, how are you doing? Are you okay today? Is your day good? Or something like that. Just check on your friends. And we are a huge network in India, and it is very much possible, just check on not even 10 people, just check on 3 people. Just ask them, are you okay? That would be what I would want to say. Yeah.
Thank you so much, Shubha. Mukti, I'm going to ask you 3 ways that we can get better access and 3 ways to bridge the gap. So both access and bridging the gap.
One of the things that we are realizing with the pandemic is there is connectivity. If not the internet, but at least there is phone connectivity. And like Shubha was saying, create awareness that to have any kind of mental health issues. It's like you have a headache. Headache is not a big deal. Same way, if you're feeling low, it's not a big deal. And to be able to create groups within their own communities and create access telephonically, and possibly also train people within the community to be able to reach out and be able to identify that this person needs help. One of the things that we did was gave us a sense of purpose to the women that we trained, and we started talking to them about anxiety and fear, so they would in turn go and reach out to people within their communities. And even as the staff of our nonprofit, the staff were calling the women at the village level to find out if they are okay, what is the need that we need to do, if there is anything, how can we do. So to not only have a sense of purpose within ourselves, but also have a sense of purpose there. The other important thing is train more people, create access to information, create access to training, and be able to fast forward telehealth, telemedicine kind of a program where we need to have the educated urban people come forward to support and help others. That will be very important to create access.
Absolutely. I think these are all great takeaways. And quickly ask you 3 ways that we can normalize these conversations. So if you can just tell us that, I think we will wrap on that note. Aries, are you there?
You're on mute.
You're on mute, yes.
Sorry. So I'm going to say these 3 things, and I'm going to say them in 3 different languages. Me, moi, main. These are the 3 things that we need to take care of. If we've taken, so let me explain the context. I, as an enabler, right? If I'm a leader, I need to be empathetic. If I'm a husband, if I'm a son, I'm somebody's daughter, I'm somebody's friend. In all of my avatars, I should be able to contribute to overall, normalization of health and wellness, mental health conversations, and spot them as well. So I think the buck, your question, stops with me.
Wow. Thank you so much, panelists. I think I can go on for another hour. Stellar ideas, stellar thoughts, and also very humbling in so many ways about the fact that the buck stopped with me. Thank you, Mukti, Shubha, and Daniel. It was a pleasure to have you all here today in conversation with all of you on something which is so very important and imperative in the times that we live in. Thank you so much for joining us, and it was, like I said, a pleasure to listen to all of your thoughts. Thank you very much. Thank you.
Thank you.